She's the CMO, the Chief Medical Officer at the New Hope Rehabilitation Center. They have been in existence since 1998. And so today, we're glad to have her just returned from the States. What would you, now, you are free to call now, those of you out of the public, you are free to call now, call 0777 511 977 or 0886 511 977. Now, you're free to call now to ask any question about stroke or any other condition that you may be having that you want us to talk about. All right? Hello?
How are you?
I'm fine.
My name is CMO.
Okay.
I live around the Flora Factory.
Yeah.
I've been following the program this morning.
Thank you.
My mother she had a spine problem on her back.
Okay.
She's been suffering from since May of last year. She's been going through a lot of treatment. So she never used to get up, she never used to sit. But this time at least she can get up, she can sit. But she doesn't bend down, and she's still feeling severe pain.
Okay. Thank you. That's your mother, right?
Yes, my mother.
Okay. The doctor will talk to you about that. Thank you. Good morning.
Yeah, morning, sir.
Morning. How are you?
I'm calling for class too.
Oh, good. Go ahead, sir.
Yeah, I got a problem with my foot. I want to ask the guy, what can I do? Because my foot can hang me. I got one sleep for 2 or 3 nights. I said I rest.
How long have you been having it?
Oh, it happened over years ago now.
Have you been to any hospital before to check?
No, Mr. Goody.
Oh, then you got to do something. We'll talk about it. All right. Thank you. Thank you. All right. Good morning.
Hello?
Hello.
Yeah. I have a serious problem.
Yeah, go ahead. Tell us the serious problem.
Yeah, I have on leg weaknesses. I mean, so I don't know a procedure. It gives me problem.
Okay. Main problem, right?
Yes, that's a weakness.
That's not your one, though. I want plenty of people inside. But she will tell you what they can do about it, what acupuncture can do about it. Sexual weakness. Some people call it impotence, erectile dysfunction. Yeah. Okay. Thank you.
Okay.
Yeah. Hello?
Yeah, hello?
Yes?
Yeah, this is Quentin Newman. I call from Lover Street.
Oh, why they have Level Street?
Yeah, Lover Street is right TRWA Junction behind the ERBC.
Oh, okay. Go ahead with your question.
Yeah, most of the time I urinate 6 times at night. I don't know the reason. I want the doctor to please tell me what's the cause of that.
You ever check whether you have diabetes before?
No.
You ever check whether you have prostate enlargement before?
No, I have not.
All right. She will tell you what to do.
It's a very long time.
All right.
This thing gets on me.
The doctor will talk to you about it. Yes.
All right.
Thank you very much. All right. Hello?
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 Yeah, I got a little problem, and I want to come down there. But because my eyes are quite clear, instead of very expensive now, I can't really see good again. The way someone come there, if I only go, I have to see about the problem.
The eye problem. Okay. Thank you. They're jotting it down. They will answer you. Hello?
Yeah, hello?
Hello?
I listen to you clearly. My wife is having a stroke right now. The left hand side, the left hand, and the left foot, it can't move. But exactly what you talk about, that why I was happening first.
Okay.
You want to have numbness in your foot.
You see?
But then we didn't know. This one, the two girls, we know they supposed to move by the machine.
Oh.
I mean, the machine to be given to her. Then December 17th, 2023. So the girl had the foot, they can't move, the hand can't move now. Then December 17th, 2023.
Oh.
Right now, the left hand side, it can't move.
Okay. All right. They will answer you.
I've been to the clinic there. They tell me the restriction, the lab, and the admission. But I can't tell my experience. They say somebody went there and they see the lot and didn't get it. But somebody told me they can't find it, they get it. And now, right now, I don't have money.
Now you see? Find where to get the money. It will help you. Thank God somebody told you they went there, a father got healed. They will help you. But find the money.
Yeah. Yeah, I thought.
On the weekend. Hello? Hello, hello? The line is on. It just gone off. Please call back if you can. All right.
Good morning, Mr. Coty, and good morning to your studio guest.
Good morning to you.
My name is Moses Kuku. I call from the Wokian community in Israel.
Go right ahead, sir.
Yeah, I have this problem with my fingers. I've been experiencing it since last year, December. My finger, I had it with my big finger. It just pains. I don't know what it can do. It just pains. It can't stay in. So I actually want to know the problem.
Okay, you're talking to me. I must have got a similar problem here, but we'll have to see the doctor. Thank you.
Yeah.
Thank you. Hello?
Morning.
Yeah, morning. You still sleeping? We can't do that on the radio. You still sleeping? Go right ahead. Go fire. Go ahead. Yeah. That's why I'm here every Friday.
Yeah. I want to ask the dying spirit because for me, there's something like when I sit for long, I feel like I'm so low. I don't know what is the problem.
Okay. When you sit for long, your foot can get swollen on your ankle, right?
When I'm walking around, I will not see that happening to me, but whenever I sleep around, 2, 3, 4, 5 hours, I feel like I'm so low.
All right. The doc will tell you what to do. Thank you. Good point. 0777511 Good morning.
Yeah,
Morning. The noise too much behind you.
Yeah, I want to know if somebody down with so what are the food the person is supposed to eat?
The food is supposed to eat. Oh, okay. All right. The food you're supposed to eat when you come down with stroke. All right. The doctor will talk to you about that. Thank you.
Okay.
All right. We can take about, okay. Let me see. Hello?
Hello.
Hello.
My name is Moses. I'm calling from Marlay.
Okay.
Yeah, I have a problem with my heart.
Your heart, okay.
Yeah, the heart is giving me a problem. I want to just it's a cloud of develop a large heart.
Okay.
So I put on sitting now.
All right.
They're giving some treatment. I'm going on here, but I don't know whether it can be so wine for all.
Okay. They will solve it. Just call the number they're going to give you and get to them.
Okay.
077. Hello.
Yes, good morning, Mr. Kuti.
Good morning.
Yes, this is with Mokwide and I call from Osuwaru, District 70.
Oh, you're in my district. Go ahead.
Yes, I heard that saying that the kidney was established since
98. Yes.
And then I want to ask as to whether they have decentralized the clinic.
That's a good question.
It's a new clinic.
Yes.
The reason I'm asking,
It's a good question. Yeah.
in Liberia, when we are into something, we may start it. And it's a bad thing. Once you are into anything, get it across so that you can make more money and then you can help more people.
Right.
So I want to ask that why
Decentralization.
would you go to decentralize the clinic?
They will tell you why. If they have done it, they will tell you. They haven't done it, they will tell you why they haven't done it. Decentralization. That's right. Okay. Let's try 3 more calls. We got 3 more minutes to 11:15, and from 11:16, then we'll start going back to the doctor. Hello.
Morning, sir.
Yeah, morning.
Yeah, I got a series of problems, but I want to tackle the one first.
Yeah.
I have problem with numbness. Cramp. More especially when I'm in bed. So my toes will just get stuck and I just fight to manage to get it free, mostly in bed. Yes.
Okay.
I just want, maybe if I get advice, then I can come over and explain the rest.
Okay. That's a good idea. That's a good idea. Good. When you get it, you explain the rest. Thank you.
Okay.
All right. Let's take this one. Hello.
Hello, Mr. Kuti.
Hello.
greetings to you.
Greetings to you too, and Happy New Year.
Wish you the same, man. And I want to appreciate you for your level of, volunteering work that you're doing for your country.
Thank you.
You're one of those who, after public service, did not just go in your grave, quote unquote, sit,
No.
but also contribute to your nation by also giving a great help the basics.
I appreciate
you are getting the services that will help, preserve people's life.
Yeah.
That will help give people a better chance to go, or for people to get a second chance.
Yes.
If they are, coming down with sicknesses that lead to their death.
I appreciate your comments.
There's a question.
Yeah.
This sickness called sickle cell.
Mm-hmm.
I want to know whether they have any idea that I can be killed in Liberia or at that clinic, because someone told me that I have sickle cell, but the person went in the interior.
Okay.
So I'm just wondering how that person would be. So I just need to pass on that.
Okay, they are here. They're going to take down the question and they will answer you on the sickle cells issue.
Thank you, Mr. Koti.
Thank you, and thank you for your comments about me. This is why we are here. After 37 years in government, I think this is another way to serve the country. Thank you. All right, just one more call now, then we go back to the doctor to answer you. Let one lucky call come in now, because after that I'm not going to take any call. All right, we have it. Hello?
Yeah, how are you?
I'm okay.
This is my Parker calling from Polo.
Paul River, good. Go ahead.
I got a little problem that confronted me with freedom.
Yeah, but the radio also giving us problem too. Cut it out.
Yes, I will look at it.
Okay.
Yeah.
Yeah, go
I
ahead.
noticed my foot, man, my foot.
Mm-hmm.
The numbness appeared, and then afterward, the pain there, and I was suffering from coffee the last year before.
Okay. Okay.
Yeah.
So you say right now you numbness and pain in your leg.
Yeah,
All
my
right.
left foot.
Your left foot.
Pain in the issue, not small.
Then you gotta do something about it.
And I was suffering from coffee last month.
Oh, you see, it's okay now.
I go to the hospital.
Mm-hmm.
Each time I go to the hospital, they say you all right. But they see my chest and see
Okay.
you all right. Go to hospital.
The doctor will tell you. Okay, the doctor will talk to you. Thank you very much.
Since the doctor started to tell her, because he was interested.
Maybe this is a lady coming in now. Hello? Hello? Okay. All right. Okay. We can take calls now. Thank you very much. Dr. Reed?
Yes.
You took down your notes.
Yep.
Yeah, go ahead, please. You got 10 minutes to do that. 12 minutes.
Okay. So, a lot of the callers were talking about, they have one caller that says spine problem, foot problem, sexual weakness, and just a heads up, like if you are, that's why we give the information, we're going to give the numbers that you can call. Most of these problems, like I said, they are individualized. You have to come, you have to do consultation, you have to let us know, exactly how long you've been having a problem, what's exactly happening to you before, there's a whole process before you can be diagnosed. Okay. And then we can be able to tell you what we can, consultation. Yes, what we can help you with and what, you will need, if you need a referral of anything, what you need to be, refer about. So most of them, they just have to come. So
yeah, but those individual points, let's touch them one by one. Okay. Somebody talk about decentralization.
Okay, yeah. So I'm coming to that.
Yeah.
So
you don't have much time.
Talk about decentralization. Well, the clinic have now been decentralized because we are still finding it difficult to have more people trained.
No, right.
That's the main problem, because training the people means we have to send them to China.
Right.
Means we have to find willing medical personnel that are willing to go and focus in acupuncture and do the training.
Yeah, that's a major thing.
Because if I'm going to open a clinic in Kakata or I'm going to open a clinic in Pong County, you can't be two places at the same time. You need more trained staff, because I already run a 12-bed clinic in Morovia, and then that one of the problems.
Number
that's
two,
something
finding
we're
a suitable
working.
Place, yes.
Yeah, we're working on it.
Mrs. Reed was here, and somebody asked that question before. She said she's going to find a place in Ganta first, and so on. That would be good.
Yeah.
Go to the next point.
Another person talk about sickle cell. Sickle cell is a gene. You know, it's from your gene. It's from what your parents passed on to you.
Right.
So it's not something that can be killed. It's something that is a medical condition that you have to monitor. You have to keep it under control. It's something that you're born with.
Right.
That's why we encourage people who are getting married now, who want to start a family, to be able to know your genotype.
Your condition. Right.
Yes, so you should be able to know that somebody with a carrier and somebody with a carrier with the possibility of them having a kid that comes down with sickle cell is high.
Very high.
So you want to know your genotype, so you don't want to get married to somebody who has the same genotype as you, so that you can.
Your child will surely have sickle cell.
Thank you.
This is why in the United States, where you're just coming from, no child leaves the hospital without being checked for sickle cells.
Yeah.
It is a must.
Yeah.
If when you are born, before you leave that hospital, they will test you for sickle cells.
Yes.
Thank you. Go ahead, Mama. The next point.
So, what else to talk about? Okay. Somebody that said the frequent urination. Yeah, like you rightly said, there are so many things that can cause that.
Yeah.
You know, so you might want to come in and get checked so that you can know what are the things that, what are medication or what condition, because most of the things are just complications of medical conditions that you have.
Yeah.
So when you know the specific condition and you get treated, then the complication tries to reduce.
Right.
Another thing is we didn't talk about was the lifestyle risk factor of stroke.
Yes.
So we talk about the medical condition risk factor, we didn't talk about the lifestyle. So lifestyle contributes to having stroke most of the times. So for example, being overweight.
Okay.
People want to watch, the weight. Obesity can be one factor, and physical inactivity. People don't exercise. They don't walk. They don't do nothing. They just wake up from bed, they get in the car, they go to work, they get back in the car. They make no time to do any physical activity. You're not walking, you're not running, you're not exercising, you don't go to the gym, you don't even take 5 minutes to stretch, to do anything.
Nothing.
So that can also cause it. Most of the time you see all the pain, you see the nerve pains associated with numbness. Those can be some of the causes. And then also we have heavy use of drug and alcohol. That can lead to stroke also.
Okay.
When you abuse drug and alcohol, it can lead to you having stroke. So that it's not just people with these medical conditions. There are people who make lifestyle choices that if you're not careful, you can also, calm down.
Some people know the names of all of the liquors in the world. Jack Daniel, Gordon Dry Gin, because everything they have tasted. So that's the lifestyle you got to put.
So you want to live a healthy lifestyle, eat healthy. There's somebody that asked the question about the food.
Yes.
So the kind of people we encourage you to come to the hospital, because like we said, you might be having underlying medical conditions. So if you have a high blood pressure, if you have, diabetes, you might want to make certain choices when it comes to, your food intake. So it's individualized. So somebody will have stroke that only has high blood pressure and they will be on a specific diet than somebody that has, high blood pressure from
that's why the consultation is good.
Yes.
And the diagnosis of the case.
Thank you. So that's very important. So I just wanted to make that point clear. But she will tell you, she'll give you the numbers to call, and you can also come.
That's very good. Dr. Reed, someone, I call you Doctor. Mrs. Reed.
Yeah.
The administrator. You have the CMO, the Chief Medical Officer, and the administrator. Please give us the numbers for your clinic.
The numbers to reach the New Hope are 0777 51 7464. 0777 51 7464 or 0886 55 9014. 0886 55 9014. Or you can call on the coach's number. He will still give you proper direction and proper information. And his numbers are 0777 511 977. 0777511 or 0886-511-977.
Thank you. Let me give you one more number that you can call, and that's the business office number. The woman sitting at the desk always. In fact, the one you will see when you go there to register, she will give you all the information. Her name is Mrs. Harris. I call her the governor. Now, 0770-210-790. I repeat, 0770-210-790. That's the number for the business office. And to call these once again, I'd like to repeat that. Maybe some of you are listening. You may call me later and say, I didn't get a number for the doctor. The administrator in studio right now is 0777-517464. That's Mrs. Reed, the administrator. She will answer you anytime. Don't call her now because she's sitting in studio. Or 0886-559014. You call that now, somebody's at the office to answer you. Or 0770-210-790. Thank you. Now,
and we are located in Painesville on Socrene Road, around Nigerian shop. The clinic is adjacent to on our Harrison County house and on our Thomas Father. He has a house in Socrene. We are adjacent to the house.
There's a signboard that you can even see there. You can look at and be directed. Okay, we're almost out of time. Any particular thing within Tash that you'd like to talk about before we close?
Yeah, so I think we touched almost all the points about stroke. Since today the topic was about stroke. So if you listened today and you heard all the signs and symptoms, you heard what you can do to prevent the stroke from occurring. So once you know what causes it, so you do the the opposite of that to be able to prevent it from happening.
Right.
So the lifestyle, the risk factor, you don't want to be overweight, you don't want to drink too much alcohol,
Smoking.
you don't want to smoke too much cigarette, you don't want to take illicit drugs. You want to be able to live a clean and healthy lifestyle, basically. And then if you have the medical conditions that can lead to stroke, you might want to keep it under control. If you hypertensive, you might want to keep your high blood pressure under control. That means taking your medication, checking it regularly, and eating healthy. So if you're diabetic, you might want to do the same thing. If you have cardiovascular disease, that is where you might want to be able to keep on top of your treatment, so that you be able to prevent stroke from happening.
Mrs. Reed, what do you want to add before we close?
Well, basically, we want to say thank you, and then at New Hope, we have a slogan. We say New Hope Rehabilitation, Fitness, and Health Clinic. We are there to serve you. And there is a quarter that talk about enlarged heart. If you got problem like enlarged heart, like sickle cell, you already have a doctor that is seeing you, and we don't want to say don't take your medicine. You can take your medications, but you can also come for acupuncture. It will help along with the treatment.
Okay.
Thank you.
There's one person who talk about eyes. You can also come there. They will test you and know what to do about it. But I'd like to also advise you to take your eye issue very seriously. You can go to the JFK. They will treat you, give you some advice on what to do. But I have brought a doctor here from the Eye Center on many occasions, and I will give you the number right away. Those of you who are having eye problems seriously, you can go there, 0770-1944-18. Call those numbers and go to the JFK for your glaucoma, your cataract surgery, all this kind of thing. There are people who have been lying to people and spoiling people's eyes in many, many corners. I don't want you to be the same. Please call this particular number and go to JFK. They have the professional equipment and the expertise to treat you there. 0770-1944-18. You will talk to one Mr. Gray, the registrar, and they will help you. Thank you very much for coming at the last minute call. And you did well for coming today.
Thank you for having
Just got back and I'll call you here today. The program has been Flashpoint, the voice of national unity, and I'm David Cote. We'll be here with another doctor next week. Our main aim here is to help you help yourself. Some of you are sick sitting there, you don't know where to go. You have certain illnesses, you don't know where to go. And when we help you, you will go to the right place and get treated. Thank you very much, and bye-bye. Happy New Year.